Ever wondered how you can detect, treat, or even prevent cancer? It's a question that weighs heavy on many minds. Cancer, an ailment that has touched countless lives worldwide, warrants our attention and understanding. Grasping the symptoms, exploring treatment options, and learning about preventative measures is crucial. Not just for those directly affected, but for everyone. Knowledge is power, and in this case, it could be life-saving. Join us as we count down the top 10 things you need to know about cancer. Starting at number 10, let's delve into understanding what cancer is. Cancer is not just one disease, but a collection of related diseases. It can start anywhere in the body, where our body's cells begin to grow out of control, forming a mass or a tumor. But not all tumors are cancerous. Benign tumors don't spread to other parts of the body and can often be removed. Malignant tumors, however, can invade nearby tissues and spread through the bloodstream and lymphatic system to other parts of the body. These cells divide more than they should or do not die when they should. As these abnormal cells continue to divide without stopping, a cancer tumor can grow. It's important to know that cancer's progression depends on the nature of the disease and the body's defenses. Knowledge of the disease is the first step in defeating it. At number 9, we have the importance of early detection. Early detection of cancer is a game changer. It significantly enhances the chances of successful treatment. Imagine it like this: you're in a race, and the earlier you start, the better your chances of coming out on top. Cancer is not so different. The earlier we spot it, the more likely we are to stop it in its tracks. In the world of cancer treatment, time is of the essence. The sooner we discover these errant cells, the higher the likelihood of halting their growth and preventing further damage. Various screening procedures are available, each designed to detect specific types of cancer. From mammograms for breast cancer to colonoscopies for colorectal cancer, these screenings are our first line of defense. And remember, many forms of cancer show no symptoms until they're in advanced stages. So, regular checkups are not just a good idea, they're a potential lifesaver. Remember, early detection can save lives. Number 8 on our list are the common symptoms of cancer. Now, these symptoms can vary widely based on the type and stage of cancer. However, there are a few general signs to look out for. Unexplained weight loss, for instance, is often the first noticeable symptom of cancers like lung, pancreas, stomach, and esophagus. Persistent fatigue that doesn't get better with rest can be a sign of various types of cancer. Skin changes can be related to skin cancer, but can also indicate other cancers within the body. Look out for yellowing, darkening, or redness of the skin, sores that won't heal, or changes in existing moles. Unusual bleeding or discharge can signal different cancers. For example, coughing up blood may indicate lung cancer, while blood in the stool could suggest colon or rectal cancer. Lastly, pain that doesn't go away can be a sign of bone or testicular cancer. Being aware of these symptoms can help in early detection. Coming in at number 7 are the risk factors. Let's dive into what factors can put you at a higher risk of developing cancer. First up, genetics. If your family has a history of cancer, you could be more susceptible. But remember, genetics is only one piece of the puzzle. Next on the list, lifestyle choices. Smoking, drinking excessively, unhealthy eating habits, lack of physical activity, and prolonged exposure to the sun without protection can all contribute to the risk of cancer. Last, but certainly not least, environmental factors. Exposure to certain chemicals and substances, including asbestos, benzene, and radon, can increase the likelihood of cancer. So, genetics, lifestyle, and environment. These are the main factors that can increase your risk of cancer. But here's the good news. Many of these risks can be mitigated with conscious choices and preventive measures. Understanding these risks can help in prevention. At number 6, we discuss prevention. So, how can we prevent cancer? Let's dive in. Cancer prevention is largely about making healthy choices and conducting regular screenings. Let's unpack that. What do we mean by healthy choices? Well, it involves maintaining a balanced diet rich in fruits, vegetables, and whole grains. It's about keeping our bodies active with regular exercise and maintaining a healthy weight. It's also about avoiding risky behaviors like smoking and excessive alcohol consumption. As for regular screenings, they play a critical role in the early detection of cancer. This includes routine physical exams and certain tests like mammograms, pap smears, colonoscopies, and skin checks, among others. Speak to your healthcare provider about the screenings that are right for you based on your age, gender, and family history. Remember, while we can't completely eliminate the risk of cancer, we can significantly reduce it through these preventive measures. Prevention is always better than cure. Number 5 on our list is diagnosis. Diagnosing cancer is a multi-step process, often starting with an initial screening. This could be a routine checkup where a doctor notices something unusual, or it could be due to a patient seeking medical attention for specific symptoms. Next, doctors may use a variety of tests to confirm the presence of cancer. This can include blood tests, imaging tests like CT scans or MRIs, and biopsies where a small sample of tissue is removed for examination. Each type of cancer has its own specific methods of diagnosis. For instance, breast cancer might be detected through a mammogram, while colon cancer might be found through a colonoscopy. Genetic testing can also play a role in the diagnosis, particularly for those with a strong family history of certain types of cancer. Remember, early and accurate diagnosis can dramatically increase the odds of successful treatment. Proper diagnosis is critical for effective treatment. At number 4, we talk about treatment options. When faced with cancer, it's crucial to understand that there are several paths to recovery. The most common strategies include surgery, radiation, and chemotherapy. Surgery aims to remove the tumor and surrounding tissue, and is often used when cancer is localized. However, it's not always possible if the cancer has spread too far or is located in a sensitive area. Radiation therapy uses high-energy particles or waves to destroy or damage cancer cells. It's often used in conjunction with other treatments, or when surgery isn't an option. Chemotherapy, on the other hand, uses drugs to kill cancer cells. It can be systemic, affecting the whole body, or regional, targeting a specific area. It's often used when cancer has spread or to reduce the risk of recurrence. Immunotherapy, targeted therapy, hormone therapy, and stem cell transplant are also potential options, depending on the specific type and stage of the cancer. The right treatment depends on the type and stage of cancer. Number 3 on our list is living with cancer. It's a journey that's far from straightforward, presenting a labyrinth of emotional and physical challenges. From the moment of diagnosis, life shifts dramatically, becoming a whirl of medical appointments, treatments, and adjustments to a new normal. Physical changes can be taxing, with fatigue, pain, and other side effects from treatment. But remember, it's okay to ask for help, to lean on others when you need to. Emotional challenges can be just as daunting, with feelings of anxiety, depression, and fear often accompanying the journey. But remember, it's okay to feel these emotions, to let them out, to seek help when they become overwhelming. Support from family, friends, professional counselors, or support groups can be a lifeline, and self-care is paramount. Eat well, exercise as you can, rest when needed, and find joy in the moments you can. Living with cancer is not easy, but with the right support, it's manageable. At number 2, we have support systems. When facing a cancer diagnosis, the emotional journey can be as challenging as the physical one. A strong support system is not just beneficial, it's essential. This network often includes family and friends, but it doesn't stop there. Healthcare professionals, including doctors, nurses, and therapists, play a critical role in providing medical care and guidance. They can help navigate the complexities of treatment options, manage side effects, and offer emotional support. Support groups, whether in person or online, can also be instrumental. They provide a safe space to share experiences, fears, and triumphs with those who truly understand. Counseling services offer another layer of support, providing strategies to cope with stress, anxiety, and the emotional upheaval a cancer diagnosis brings. Remember, no one should face cancer alone. A robust support system can help carry the burden, provide comfort, and bolster resilience. A strong support system can make a huge difference in a cancer patient's journey. And finally, at number 1, we have hope and progress. The world of medical science is a continuously evolving landscape, always pushing the boundaries of what's possible. Every day, new advancements in cancer treatment are being made, bringing a beacon of hope to patients worldwide. From innovative surgical techniques to groundbreaking drug therapies, the fight against cancer is becoming increasingly successful. These strides in medical science are not just about extending lifespans, but improving the quality of life. With the advancements in medical science, there's always hope for a cure. So there you have it, our top 10 countdown on cancer. From understanding the nature of this disease, recognizing its symptoms and risk factors, to exploring prevention strategies, diagnosis, and treatment options. We've also touched upon living with cancer and the importance of support systems. We've seen that there's hope, progress, and an increasing number of survivors. Remember, knowledge is power. Stay informed, stay healthy,